Okay, let's look at the abdominal muscles, but before we look at the abdominal muscles, there is fascia that overlies the muscles of the in the abdominal region. There's a line of fascia that runs through the middle, and the umbilicus is right in this area. This fascia that runs through the middle, it is for a muscle attachment, is called the linea alba, which translates white line, basically. And this fascia, we've already talked about it once before, the aponeurosis, helps to maintain the integrity of these muscles and protection and for attachment. And the abdominal muscles, the first one is the external oblique. The external oblique runs the direction like you would be putting your hand into your front pocket. So it runs this direction of the abdominal wall. If you were to cut this away, the next layer of muscle, second layer of muscle, would be the internal oblique, and it runs a little opposite of the external oblique. External oblique, internal oblique. So it runs the opposite direction. Now to see the transversus abdominis, the third layer of muscles, notice how it runs pretty parallel to the floor if you were standing erect. So the external oblique and the internal oblique run in different directions, and then the transversus abdominis also runs more parallel. So you have three layers of muscles plus the aponeurosis and the fascia here that help to hold your internal organs in place, hold them inside of you. So if you were to have abdominal surgery, they would have to cut through all those layers of muscle. And sometimes to have abdominal surgery, it affects the integrity of those muscles, so they don't do as good a job as they should. Now, you've heard of a six-pack. This is the rectus abdominis, and in this area, the rectus abdominis is covered by fascia, the aponeurosis, and then there is the rectus abdominis. Okay, let's go over the upper leg muscles. We're going to look at the anterior muscles first. And in your lab manual, this would be in figure 23.1. First, the sartorius. The sartorius is this muscle that runs here. It goes from the iliac crest to the medial tibia. So it runs across the front from the lateral to the medial. From the lateral to the medial. That is the sartorius. The rectus femoris is here. The rectus femoris. Here's the rectus femoris. Now the vastus lateralis. If you look at more laterally here, vastus means it covers a wide area. Okay, so here's part of the vastus lateralis, and there's the vastus lateralis, and up here, vastus lateralis. Now this is called the iliotibial band. It's fascia that runs over the vastus lateralis. And then here's the vastus medialis. The vastus medialis. There's the kneecap, the patella. And here's the vastus medialis. Vastus medialis. Remember those directional terms? Medial toward the midline, lateral on the side. So vastus lateralis, vastus medialis. Now the rectus femoris, the vastus lateralis, and the vastus medialis makes up the quadriceps femoris group. Now on the inside of the thigh, right here, that runs from the bottom of the coxa down to the medial tibia, that would be the gracilis. On the inside of the leg, the gracilis. Right here, gracilis. Okay, let's look at this leg model and go over the muscles you need to know. First off, this is sort of a medial view. The sartorius, the rectus femoris. I'm going to skip over here and show you the gracilis before we turn this leg, the gracilis. And since we are looking at a medial view, vastus medialis, the vastus medialis, this sartorius runs over the top of the vastus medialis. Okay, let's flip it a little bit. And there's the vastus lateralis. And there's the iliotibial tract, runs from the crest of the ilium all the way to the tibia. Thus its name, iliotibial tract. Okay, it runs over, it's fascia that runs over the vastus lateralis. So again, can you find the sartorius, the rectus femoris, the vastus lateralis, the vastus medialis, and the gracilis? And the only muscle that you need to know on the lower leg, where you get a Charlie horse usually, is the gastrocnemius. So the gastrocnemius is divided into two parts. It would be the lateral and the medial. So the lateral would be on the outside and the medial on the inside, but the gastrocnemius. And there's the leg model. Okay, let's continue to look at leg muscles. This is the posterior view, the gluteus maximus, and the iliotibial tract or band that overlaps. It is fascia that overlaps the vastus lateralis. So this is the lateral side of the leg. And on the posterior leg, the more lateral muscle would be the biceps femoris. More medially would be the semitendinosus. Semitendinosus. Now, here and here you see a muscle that's underneath the semitendinosus. That muscle that is underneath the semitendinosus, and it protrudes on this side and on this side. Laterally and medially it protrudes from under the semitendinosus, and this is the semimembranosus underneath. And then again the lower leg, the gastrocnemius. Okay, one more time. The gluteus maximus, the biceps femoris, semitendinosus, and underneath it the semimembranosus. The biceps femoris, semitendinosus, and the semimembranosus make up the hamstring group. If you've heard somebody has pulled their hamstring, they've pulled a muscle or a couple of muscles on the back of the thigh here that are part of that hamstring group. Okay, let's look again at the muscles of the upper leg and the lower torso. This is on a different model. This is the little man model. the gluteus maximus, and your lab manual has printed for you in figure 23.3 the vastus lateralis with the fascia over it, the fascia, that iliotibial tract or band. And so more lateral on the back or the posterior leg or thigh would be the biceps femoris. Biceps femoris. The semitendinosus. The semitendinosus. And then the semimembranosus, we see it underneath here. Semimembranosus underneath the semitendinosus. Now on this model, we can remove this, and the semitendinosus overlap the semimembranosus. So this would be the semimembranosus that would be found under the semitendinosus. The gastrocnemius of the lower leg. The only muscles you need to know in the lower leg.